We will start today a wonderful, a long and interesting journey through veterinary ophthalmology. And the title is quite wonderful, I love it. Veterinary Ophthalmology from A to Z. When you are thinking to deal with ophthalmology, you need to have information, a correct and complete one. And the idea about this YouTube channel, linking with veterinary ophthalmology, belongs to Alexandra Cornea, a wonderful friend, who told me one day like this: you are teaching for many years. You have a lot of knowledge. You love to teach. You love to share your knowledge. So let's start to have a YouTube channel. In the beginning, I wasn't so happy, but right now, trust me, I love it. And all the time when I'm recording this and I have another course in Romania or in English, I am very happy and I have a lot of joy and fun. So our first course, it's the first step in veterinary ophthalmology, and I want to point it somehow from my experience. And in this course, we will deal with anatomy, some kind of knowledge about histology of the eye, but let's go forward to think about what to do next. If you want to deal with veterinary ophthalmology, you must have a list. You are making a list in your head, or maybe you must write somehow this list. The first word in this list must be respect. You must respect yourself because you learn a lot. You must respect the owner, and of course, you must respect your pet. In veterinary medicine, and of course in veterinary ophthalmology, you must have one idea in your head. You are doing your best, but the owner must help you. And we are working like a team. We are performing surgeries, for example, but the owner must understand the importance of all the treatment after the surgery. So first, you must pay respect for yourself, for your pet, and for the owner. You must have patience because not all the eye disease is healed. It can be healed in 2 or 3 days. Sometimes you need weeks, or sometimes you need months to treat an ocular disease. You must have patience. When you have patience, you love ophthalmology. So when you are going at your job and you are happy about this, everything will be wonderful in your life. And of course, you must have a lot of imagination. A lot of imagination because you must pick the information that you need to go forward to have a diagnosis and a good treatment. Try to compare all the time the lesions on the cornea, for example. And if you are comparing the lesion with a disease, linking with a disease, it will be very easy your job. For example, I choose that wonderful picture with corneal indolent ulcer. When the cornea is like this, and you can compare this lesion with an open book, you are sure about the diagnosis. You have an indolent corneal ulcer. In the courses that we'll have next to this, I will show you my way to have a diagnostic boxes for each structure of the eye. When you are putting your case in a diagnostic box, will be much more easy to treat and to understand. And it's very important that somehow you must have a lot of information about the eye diseases or the eye disease that is a symptom in a systemic disease. Sometimes the ocular disease can be a tip of the iceberg, and we will deal with this too. Of course, we are very happy when we are buying new toys. You need in your clinic, when you are dealing with ophthalmology, to have new toys. New toys help you in diagnosis, a complete one, a certain one, and of course, correct one. And in this way, you will have a proper treatment. And of course, last but not least, you need knowledge. You need to learn all your life. You need to attend congresses, and you need to be better and better. So we will start this journey in veterinary ophthalmology with the answer to this question. how much anatomy and histology we need to know to treat eyes and, of course, to perform eyes surgeries. Why? I want you not to raise barrier in front of you, and don't let nobody to tell you you can't. You must deal with treatment in ocular diseases, but don't be scared to have a scalpel in your hand and to perform eye surgeries. If you know anatomy and you know the techniques, it will be very easy. So don't let nobody to tell you you can't be a good surgeon. You can be a good surgeon, but the most important part is to start to perform the first surgery, and you'll enjoy the surgery, ocular surgery. I think we need to know enough anatomy and histology not to make huge mistakes, and it's very important in our job to know our limits. If you know your limit and you send the X-Files case to another person, another doctor who knows much more than you, it will be fine. So you need to be very respectful about your patient, and of course to send the patient when something is going wrong somehow. So let's try to point some notion about eye, structure of the eye. We need to know about cornea and of course about sclera, the external tunic of the eye. Don't forget about the limbus, the part where the sclera is linked with the cornea. We need to know about the anterior chamber of the eye, that is between the posterior epithelium of the cornea and the anterior epithelium of the iris, and of course about the posterior chamber of the eye between the posterior epithelium of the iris and anterior capsule of the lens. We need to know about vascular tunic of the eye, that it's formed from starting from iris, ciliary body, and choroid. And of course, we need to know about vitreous and ocular fundus, that we need to check all the time in all our patients. To examine the anterior pole of the eye, so cornea, anterior, posterior chamber, and the lens, we don't need to have mydriasis, but when we need to perform the examination of the posterior pole of the eye globe, we need to have drug-induced mydriasis using atropine, tropicamide, whatever. You need a mydriatic. So I put on the list the most 8 important things. What I need to know, not to make mistake, not to make mistakes, huge mistakes, something like this. I put on my list the free edge of the eyelid, because here we have a wonderful structure, Meibomian gland. And it's very important that we have a lot of pathology here. The structure of the cornea is very important. We need to know all the time that the cornea has 5 layers. And the most important part in this structure of the cornea is that the posterior corneal epithelium become anterior epithelium of the iris. And you must keep in mind all your life that the penetrating corneal wounds are posterior keratitis or anterior uveitis. We will talk a lot about this. The structure of the third eyelid, we need to know that the third eyelid structure has a third eyelid gland and of course cartilage. Why we need to know this? Because the third eyelid surgery we are performing in many cases in our clinic, but you need to know it's about averted cartilage surgery or it's about the hyperplasia and prolapse of the third eyelid, or can be both. The shape of the blood vessel on the cornea when we have their ulcer. In healing process, the shape of the blood vessel will tell you a lot of information, and you need to start to learn to read cornea. The structure of the uvea is very important too. The uvea has an iris, ciliary body, and choroid. Zonula Zinn, it's very important too, because we need to understand the lens luxation. The lens luxation can be secondary to glaucoma, cataract, but can be secondary to intraocular tumors. And it's wonderful, and it's wonderful to go forward with the ocular ultrasound to have a proper diagnosis. And of course, the structure of the ocular fundus is very important to know. We have here 4 elements: tapetum lucidum, tapetum nigrum, retinal blood vessels, and papilla of the optic nerve. It's very important to know this because you will have in your clinic a lot of cats with hypertension, arterial hypertension, and you need to know this. You need to know the normal structure and to pick up the information when your cat has arterial hypertension. Let's go forward to talk about, of course, the first on our list, the free edge of the eyelid. We are in the front of these 2 cases. Meibomian gland, it's on the free edge of the eyelid, and this chronic inflammation can be chalazion, or we can have here a tumor of the eyelid. And when it is a tumor of the eyelid linked with the Meibomian gland, we know how to do it. We will perform the surgery. And this is, of course, a surgery case. But when all the Meibomian gland are with inflammation, it's very important to understand that this case, we need to treat with systemic antibiotic and anti-inflammatory. So it's very important to keep in mind this structure of the free edge of the eyelid. The structure of the cornea is quite important, and it's very, very, very interesting to know. And I will point it why it's very important to know that the structure of the cornea, has 5 layers: the anterior epithelium of the cornea, the basal membrane under it, stroma, a huge stroma here on the structure of the cornea, desmet membrane, it's elastic and it's very important in diagnosis too, and of course the posterior epithelium of the cornea. And try not to forget in your life that the posterior epithelium of the cornea become anterior epithelium of the iris. Somehow you need to keep in mind all your life this, because this is the link between a non-vascular structure, cornea has no blood vessel, and of course with the vascular structure of the eye, and we are talking here about uvea. It's very important to know this. Why it's important to know this? Because when you know the structure of the cornea, you will know the lesion can be superficial, deep, can be a hernia of the membrane, desmet membrane, or we are dealing all in the traumatic penetrating corneal wound, all the structure of the cornea is involved. And we need to know which structure from this cornea is affected, because we can treat it local, systemic, or we must go straight away to the surgery room. And when the anterior epithelium is involved, we have a superficial corneal ulcer. When it's going much more deep and the stroma is involved too, we have here a deep corneal ulcer or a desmetocele. Here we need to go to the surgery for sure. When we are dealing with penetrating corneal wound, our cornea became blurred and you can't see inside nothing. And this penetrating corneal wound became an anterior uveitis, chorioretinitis, and we can lose the vision, and of course we can lose the eye. And if we know all the time the structure of the cornea, we will go straight away to a right diagnosis and the correct treatment. The posterior corneal epithelium become anterior epithelium of the eyes, of the iris, is very important, and we will point it again. So the penetrating corneal wound, when the foreign body, for example, or a cat claw will point the cornea, all the structure is involved, and the posterior epithelium will react, and we will have this opaque cornea. And of course, after this, we will have secondary uveitis. And the eye will show you this. The cornea is opaque, we can't see inside, and we have this straight, short blood vessel all over near the limbus. It's very important to understand that the penetrating corneal wound is a posterior keratitis or an anterior uveitis. The structure of the eyelid we need to know. We must perform surgery, but we need to know about the cartilage, and when it's the normal cartilage, this case is not for surgery, but when we have everted cartilage too long for this third eyelid, we need to go straight to the surgery room to perform the everted cartilage surgery. And we need to know about this third eyelid gland, and in many dogs, in many breeds, we are dealing with hyperplasia and prolapse of the third eyelid. So we need to know the structure of the third eyelid because we have here two kinds of surgeries, for everted cartilage or for third eyelid gland too. The shape of the blood vessel in the healing processes of the cornea are wonderful. This blood vessel will tell you, here you have a superficial lesion or it's a deep lesion. It's a deep corneal ulcer or a penetrating corneal wound. And we have two shapes of this blood vessel who are struggling to heal the cornea. When I have here on the cornea a lesion and the fluorescein test is positive, like in this picture, the blood vessel will come from conjunctiva because it's a superficial lesion. And this blood vessel, if you compare this blood vessel, for sure you will see the roots of a tree. It's like a fan, and they are going straight to the lesion. This lesion, it's a 1-day lesion, 2-day lesion, 5-day lesion. It's superficial, but in the same time, you can have the same shape of the blood vessel, like roots of the tree, compared to roots of the tree, but you can have the edema of the cornea near your deep corneal ulcer. This is about superficial or deep corneal lesion. But when you will have straight, short blood vessel all over the cornea near to the limbus, and you have this blurred cornea, you must keep in mind that these blood vessels are coming from uvea, from deep inside the eye, to deal with something much more worse. We are dealing here with uveitis. So keep in mind the shape of like the tree roots or this straight, short, brush-like blood vessel. There are two different categories of blood vessel, two different type of diagnosis and treatment too. The structure of the uvea. If you are keeping in your mind that the uvea is iris, ciliary body, and choroid, you will understand that when we are dealing with the inflammation of the iris with iritis, where the eye is showing you pain with small pupil miosis, and all these changing of all these changes of the iris with blood vessel, with inflammation, and of course in the aqueous humor we have keratic precipitate. We must go straight away to think this is the first stage of a uveitis, and you must go forward with the treatment, systemic with using antibiotic and anti-inflammatory. Otherwise, the inflammation will go forward, and we will have, of course, involved the ciliary body and the choroid. And right now, we will not have any vision. When the choroid is involved, of course, the choroid is linked with the retina, and the retina will be damaged too. And of course, in this uveitis, when we have a chronic long-term uveitis, we can have, of course, the retinal detachment. Keep in mind, when we are checking the eye, and of course, if we are lucky and we have in our clinic the tonovet or tonometer to measure the intraocular pressure, and of course, here we have low intraocular pressure, and all these changing of the iris, go straight away with a very systemic treatment using antibiotic and of course anti-inflammatory. About Zonula Zinn of the lens, we need to know about lens luxation, because lens luxation can be, of course, anterior, and when we are checking the eye, the lens is in the anterior chamber of the eye, and this when it's and we are facing here with the ocular emergency, or we can have posterior lens luxation or we can have a vertical lens luxation like in this picture, and this picture it's a wonderful one, and we can see the ocular fundus here like half of the moon, and this yes, symptoms it's named aphakic crescent. Why it's important to know about this Zonula Zinn of the lens? The lens luxation, I told you before, can be linked with cataract, can be linked with glaucoma, but can be linked with intraocular tumor. And we need to know why this is happening. Can be a glaucoma and we must treat it, or we must go to surgery for intrascleral prosthesis, for example, or we must remove the eye if this lens luxation is linked and is secondary to intraocular tumor. And we need to know this, of course. The structure of the ocular fundus, you need to keep in mind these four elements of the ocular fundus. Tapetum lucidum, it's quite bright, wonderful color up here. And of course, tapetum nigrum down of the ocular fundus. We need to check the retinal blood vessel, and they are wonderful, and the papilla of the optic nerve. And here we have a ocular fundus of a cat. So the tapetum lucidum up here, but the difference between cat and dog, it's this shape and the position of the papilla of the optic nerve. The papilla of the optic nerve in cats is in the tapetum lucidum, and it's a round, wonderful shape. And of course, for dog, the shape of this papilla of the optic nerve, it's like a flower. It's a wonderful one, and it's between the tapetum lucidum and tapetum nigrum. If you have 1 minute to perform an ocular fundus examination using an ophthalmoscope in all your patient that is coming in your clinic for deworming or vaccination, you will understand the normal structure of the ocular fundus, and when you are dealing with the ocular fundus problem, you can very easily find out the problem. So if I know the normal ocular fundus, and of course I am checking the ocular fundus of this cat, and we have a lot of blood, a lot of hemorrhage here, retinal hemorrhage, and somehow detachment. For sure, I am facing with a cat with hypertension due to renal failure or due to cardiac disease. It's very important. So when we are dealing with this hemorrhage, cut from your list hypertension cat. And of course, when you are not seeing quite wonderful, perfect ocular fundus like here, it's blurred. It's like you are watching through a very steamy window. It's not clear. Think about uveitis too. So it's very important that I know the normal structure, and of course I can see very easily what is wrong here. Here I have retinal bleeding and of course detachment. It's very important that we are dealing a lot in our clinic with retinal diseases, can be congenital, and the most important one, and it's quite often in Labrador and Golden Retriever and in Border Collie. We have a lot of breed linking with this progressive retinal atrophy. When you are checking the normal ocular fundus, I told you, we need to check the tapetum lucidum, tapetum nigrum, the papilla of the optic nerve, and the blood vessel. When you are checking the ocular fundus in a cat or in a dog, and the retinal blood vessels are missing, the dog or your cat has progressive retinal atrophy. It's very important. And this is very important when you are checking, because this disease is a disease that, of course, the dog, the cat is blind. And the most important part is to tell the owner that it's not fair to have breeding. It's very important. Don't breed that dog or that cat if you are a breeder. So for today, this is enough, I think. How much anatomy and histology I need to know, not to make mistake. It's easy. We have in front of our eyes is that list about free edge of the eyelids, and of course, still structure of the ocular fundus. The second course will be about examination in ophthalmology, and because the examination in ophthalmology is a long, huge chapter, I divided in Schirmer-Tear test and fluorescein test and ophthalmoscopy and tonometry, and we will go forward maybe in 6 or 7 courses with this examination in ophthalmology. And after this, we will start to deal with surgeries and with the disease of the orbit, of the eye globe, uvea, cornea, and of course, lens. We will see next week with the second course examination in veterinary ophthalmology.